I'm going to go through each line and say what I would do different. I don't have anyone to play the provider and me play the patient and me play the provider. So I'm just gonna kind of go through each line and say what I would say different. Hello, Miss Jones. Do you care if the students listen in while we are talking today? I guess not. I just want to feel better. I hope that you can help me. And he says, I'm sure, I'm sure we can. So tell me why you are here. And I would just kind of rephrase that. Absolutely. Tell me what's going on with you today. Well, I'm having pain in my side, and then he goes on to say which side. Instead of interrupting the patient, I would let the patient finish the sentence before entering. A lot of times you want to, stop and listen, take in what the patient is saying instead of interrupting them. And a lot of times, also by interrupting them, you can make the patient feel rushed. So we don't want to do that. So I would just stop and listen to the patient. Which side? In this side. And I'm guessing she's pointing out whatever side. When did you first notice the pain? It started last week and hasn't really stopped. I was having kind of a rough week. I would just kind of show my sympathy towards her. Well, I'm sorry you're feeling that way. Hopefully, we can get something done for you today. Or I'm sure we can get something done for you today. Kind of giving her that assurance, that we're gonna get something done for you today. We're gonna get you to feeling better. And then it says, how would you rate your pain? If the pain was no pain, if 0 was no pain and 10 was the most pain that you have ever had, how much would you say the pain is? Um, Sometimes, well, it's a high 6, but right now it's probably more like a 3 or 4. But maybe, and then the provider interrupts the patient. Instead of interrupting, as I said before, listening to the patient, letting them know that you're hearing everything that they're saying, not making them feel rushed by interrupting them and they aren't finished with their sentence. And he has, sorry, just a few more questions. Do you feel like vomiting? Or have you vomited? And any diarrhea? Like I said, don't interrupt the patient. Let the patient finish. And then once the patient finished prior to what he just said, um, he could have, stated, "Are you experiencing any vomiting, any diarrhea?" And then the patient goes on to say, "I felt a little queasy, but I haven't thrown up, and I have diarrhea." And then the provider goes on to say, "So how many times a day are you having a bowel movement?" And then the patient says 2 to 3 times. It's pretty loose. And the provider goes on to say, "We call that loose stools, but not diarrhea unless it's more than 5 stools per day. We're almost done. Just a few more questions. But can you tell me if you've ever had any abdominal surgery?" Um, I would just kind of, I wouldn't, if I were the provider, I wouldn't have said that. It kind of, I don't know if this is the right thing to call it. It kind of belittles the patient in a way. If she refers to it as diarrhea, you know, just kind of go with the patient. Don't make them feel, kind of less than because you are the provider and they're the patient. Kind of like more. I mean, yes, you've been to school and things like that, but we always want to make our patients, make them feel good. Um, Instead of saying, "Well, we call that loose stools, but not diarrhea unless it's more than 5 stools per day," I would have just said, um, I would have just said, "Thank you for giving me, thank you for answering that for me. We're almost done. Just a few more questions. Can you tell me if you've ever had any abdominal surgeries?" That's a way I would reword, what he just said. No, I don't think I, no, do you think I need any surgery? And instead of him saying, at the moment, I don't feel that, but I'm just trying to ask a few questions in order to see, what the plan is. He goes on to says no, just a simple no, which doesn't give the patient any reassurance, doesn't make them feel at ease. He just says no. When was your last period? Which is kind of like, he kind of doesn't know anything. The patient is left thinking the worst probably. Um, then the patient goes on to answer, I'm pretty irregular, so I'm not sure if I have one last month or the month before. And then he goes on to say, are you on the pill? No, but I don't think I'm pregnant. And it says, we'll just get some blood to be sure. We'll just get some blood to be sure. How about urinating? Are you peeing more than usual or burning when you pee? Um, I don't know that the patient is thinking this, but if I were the patient, I would probably think this. When he asks the patient, is she pregnant? And she says, no, I don't think I'm pregnant. And he goes on to say, well, we'll just get a blood test to be sure. It's good to, say that to the patient, but it's almost as if, you're telling the patient, you don't know your own body, things like that. We'll just get a blood test just to be sure you're not pregnant. I mean, it just depends on who the patient is and how they would take what he said. But I would just, just say, we'll just get some blood work to make sure everything is okay. Even if you were to put it in a sense, let's get a blood test to be sure. Just we'll get some blood just to make sure everything is okay. Not making the patient feel as if, oh, she's pregnant, I would just reword it a little different. Um, then it goes on to say, I don't think so. When she says, is it burning when you pee? He said, well, we'll check the urine too. Any blood in your stool or is it ever black? And then she says, I haven't seen any. And the provider says, okay, we've got what we need. Now I'm going to get the students to step out and we'll get some blood and urine for tests. And then we'll do your exam. He probably just could have gave the patient a little more information. I thank you for answering these questions. I just need to get a little more blood work so I can see, everything, make sure there's nothing in the blood test or in your urine cultures, that, has any red flags. Then she goes on to say, do you know what's wrong with me? And then he says, not yet, but I've got some ideas. And the blood and urine test in your example should help. Just try to relax and I'll be back in a few minutes. That kind of gives some reassurance as well, but as a provider, just explaining, everything she's explained, you should kind of know like a few options just to give her, maybe this is wrong, but we don't want to jump the gun. We want to get some blood work and some urine tests just to be sure what is wrong with you. But that's just how I would kind of rephrase everything that he said, kind of giving that patient that reassurance, kind of making them feel at ease. They're already not feeling good coming to the doctor, so just want to make them feel good. Thank you.